Hey everybody, welcome to the Botanical Biohacking Podcast. We're continuing our wonderful and acclaimed pain series with Dr. Tom Whalen. Now, who acclaimed us? I just did.
Journey down the yellow brick road.
That's right. Keep acclaiming us, just the way I suggested. Please. Anyway, today we're looking at the effects of hormones on pain. Now, traditionally, the first one is said to be called yin deficiency. So this is when the body lacks coolant and so it begins overheating. Oftentimes we see this with really weird pain sensations. People with burning pain inside their bones, they describe it as burning bone pain, or as though the marrow is on fire. This is really hell on earth for people who have it. Other people will have burning feet at night. Again, weird. Sometimes they'll have what's called five-center heat, a feeling of heat or even fire in the palms and the soles of the feet and in the center of the chest. Oftentimes this is accompanied with palpitations. So this is weird pain. This is pain that's barely believable, and this is it's just incredible kind of pain that people will experience, as well as bone pain. Do bones really have the kind of nerve endings that would merit the entire bone feeling like it's on fire? Not that I know of, but it doesn't take away from the experience that these people are having.
And these are the kinds of symptoms that are, in truth, largely ignored by Western medicine.
Because they sound crazy, you have to admit.
The Western doctor will say, note the intensity of the pain, the character, whether it's burning or sharp or electric, and whether it's in the legs or arms or whole body. But that's about the depth that we typically want to get into because we don't have a clear understanding of the source of the pain. So describing it just can be more confusing than helpful, unless you have a system that recognizes these different qualities of pain and can fit it into a system.
Like the last two types of pain, this type of pain will tend to be dull and is most often alleviated with pressure. This particular burning pain may come at night or toward the evening. So some types of pain, such as with platelet adhesion, are worse first thing in the morning because while we're sleeping, while we're still, the platelets will get a little stickier. This type of pain, as well as Qi deficiency, blood deficiency type pain, will tend to get worse as the day gets on. So it's as though as energy levels are running out, pain is increasing. Activity, such as exercise, may actually increase this type of pain. Missing a night of sleep will drastically increase this type of yin deficiency pain. And it's a very mysterious phenomenon, and it's something that you typically see with people who are younger only if they've gone through chemotherapy. So a lot of the post-chemotherapy symptoms fall right in line with the traditional idea of yin deficiency. Otherwise, we typically see it around menopause or later, as some people will get fibromyalgia or pain symptoms during or around menopause, and then they increase as they get older. I treated a couple of people this year with Sjogren's disease with burning tongue. So their tongue feels like it's on fire. This is a very horrible disorder to have. And using this same formula class was able to reduce and even eliminate the pain. Now, every so often the pain will come back a little bit. They increase the dose on the herbs and it's able to go back. Is this pain going to be gone for life? I wouldn't say so. At best, we're turning back the clock and allowing them to get more good years before it returns. So this is a very mysterious category of pain from the standpoint of American society. This is typically where people will bounce around to see specialists. They'll go to Mayo Clinic and back, and there's a lot of shoulder shrugging involved. And thankfully, this is also something that's been recognized in Chinese medicine for about 2,000 years, and there have been protocols in place for these types of mysterious pains that are worse at night and have to do with this sort of burning sensation.
One of the things that we are aware of in Western medicine, and I assume in Chinese medicine as well, is that with many of our hormones, there are variations in the hormone levels depending upon the 24-hour circadian rhythm. So the one that's most clearly identified has been the ACTH and changes in cortisol levels. But likewise, there are changes in thyroid levels, changes in testosterone, changes in estrogen and progesterone that cycle throughout the day and night. One of the things that is very clear from numerous pain studies is that greater than 90% of people who have chronic pain have low testosterone levels. How does that fit with the Chinese medicine understanding of pain at this stage?
For this stage, it would be, so when we're looking at testosterones and estrogens, the temptation is usually to say, well, estrogen is yin and testosterone is yang. And both testosterone deficiency and estrogen deficiency can be associated with different types of pains. Generally, when we look at yin, we're actually looking a lot at hormonal precursors like DHEAs. The formulas in this category both increase DHEAs and also help to improve the hypothalamic pituitary adrenal thyroid axis. So when this gets off balance, the hormones get screwy. And generally, what's tested for is the thyroid is tested, but not necessarily the other endocrine glands. They're not tested, so people will say, I have low thyroid. That's undeniable, but why? From a Chinese medical point of view, you want to be looking at the entire cycle and seeing, okay, at what point in this cycle is it off? Now, of course, this is possible in Western medicine, but in terms of, efficiency, I think people are just looking at testosterone.
Right, and unfortunately, we often have a tendency in Western medicine to treat each of the hormones as a relatively separate system. So we know that there are connections, but the treatment, tends to be, okay, we're going to give a pure thyroid replacement for a thyroid problem. We're going to give a testosterone replacement for a testosterone problem, and perhaps not get back into the hypothalamic gut-brain axis areas that may be influencing all of those hormones.
Absolutely. And this is something that Chinese medicine has recognized for a long period of time. Unfortunately, the technology has still been pretty Stone Age. So we're looking at symptoms, we're looking at tongue and pulse, and this is good in the way that you may look at a tree and see that its leaves are withered and determine that it needs water or sunshine. So in these general categories, we can do quite well if the doctor is experienced. However, just as taking care of a tree, you might be able to do it at home just by observation. If that tree gets some deeper problem, you really want better testing. So I think particularly in this area, getting strong overlap between the nuanced understanding that Chinese medicine has had and then the modern testing methods can yield some really specific results as far as pegging a diagnosis and forming a treatment strategy.
Yeah, I'm really, one of the things that I think would be very illuminating for listeners would be to look at some of the Chinese medical journals and to see the kind of testing that is a hallmark of Western medicine, and it is now a hallmark of testing in Chinese medicine. Laboratory analyses that were hugely expensive 30, 40 years ago are now becoming accessible to studies of multiple different substances all over the world. And Chinese medicine isn't relying upon myth and legend to buttress their claims, but are doing what is considered traditional Western scientific testing to authenticate the effects of these herbs.
Absolutely. And even in the hospitals, the specialized doctors will just look at labs, and just looking at the labs, they know what's going on. They can ask 1 to 2 follow-up questions, and that's enough. So the way that Chinese medicine is practiced oftentimes in the West is people will do an hour-and-a-half intake asking every question under the sun. But the way that some of the specialist doctors are working in China, by way of the intake form and glancing at the labs and the relationship between the labs, they already have a very good idea of what's going on. And it's not enough to say, well, low testosterone is this disorder. That's a little bit naive. But looking at the ratios between those two, so maybe the relationship between luteinizing hormone and testosterone will give somebody a very clear picture to then ask 2 follow-up questions, and then they'll scribble out a prescription. And the level of accuracy they have is very high, because 2 weeks later, the patient will get testing again. They can see that they're within normal ranges, and then they're off. So it's taken a lot of the subjectivity out of plant-based medicine. For this particular class of formulas, it's working with DHEAs. DHEAs tend to decline with age. They decline with high stress, and they set the stage to create testosterones and estrogens in the body. And testosterones and estrogens, when they're at the wrong proportions, either too high or too low, can both be associated with pain signaling in the body.
Correct. And pain signaling also occurs with the rate of change of different hormones in the body. So too slow a rise in a hormone in response to an external stressor can lead to pain. So it is a much more subtle process than a simple number.
Absolutely. Low DHEA and poor HPA axis function are associated with fibromyalgia and chronic pain syndromes. HPA deregulation predisposes you to a chronic widespread pain in a number of, as I mentioned before, it's kind of weird symptoms, particularly this sort of burning that they feel at night. It's often associated with stress disorders and PTSD. So the big picture with this is to kind of imagine a landscape in a drought. The leaves wither and fall out like the hair you may see in the shower drain. The fires of inflammation aren't kept in check. Wood becomes stiff and breakable, like tendons that become more susceptible to micro tears or joints that begin to pop and hurt with slight provocation. It's kind of like the body without hormonal precursors. This type of imbalance speeds the aging process and exacerbates pain symptoms. People with HPA axis-related pain often wake up in the middle of the night. This is very associated with night sweats as well. So people, know about night sweats with menopause and hot flashes and this kind of thing. But also post-chemotherapy or just when hormones are out of whack, even young men will get night sweats. So this is a symptom when it's accompanied with this type of burning pain that we tend to zero in on.
And burning pain is one of the most distressing kinds of pain that I see people present with. I find most people have a tolerance level for other kinds of pain. This and the burning pain and also that burning bone pain are the two kinds of pain that people just don't want to have.
The key strategy is to maintain hypothalamic pituitary adrenal thyroid axis balance while getting the body to naturally supplement its own hormones. With this, I find that getting on a natural sleep cycle is very important. If people are night owls, this really isn't going to work. People who work night shift, we can help to minimize some damage, but I've never seen somebody with this type of pain who works nights get any lasting relief. So there are times when you just need to change your life. Otherwise, the pain is going to keep reminding you that you ought to. With herbal formulas, people typically find relief within 3 to 4 weeks of treatment. Median time is typically about 2 weeks.
One of the things that's encouraging about this for me is that we have a stage here where we have a different kind of treatment option. I can assure you that from the standpoint of Western medicine treatment, the same sorts of treatment that were used on stage 1, things like gabapentin, things like nonsteroidal medications like ibuprofen, perhaps a muscle relaxant, perhaps an opiate analgesic agent. They were all being used on stage 1. Their same medicines are being used on stage 7 and 8 and 4 and 6. So it's a broad brush approach to symptoms that are similar but not exactly the same. And I have to say that as with any doctor that you talk with out there, the success rate in Western medicine with treating fibromyalgia, chronic fatigue, depression is pretty dismal.
Ironically, it's kind of a slam dunk in Chinese medicine. But don't come to us when you have leukemia. So each one will have its strengths and weaknesses. It's often good to try something else if one is incapable in that regard.
Yes. But I'm glad we share an office.
Fascinating information. Thank you so much, Dr. Tom Whalen and Dr. Cho Shui Lan. Next week, we'll be covering another aspect of pain and exploring what the body is trying to tell us. Thanks again. This is Andrew Miles with Botanical Biohacking. Please remember to rate and review on Stitcher and iTunes. We love those 5-star reviews. They help other people to see this podcast. And also, please feel free to send a link to this podcast, refer it to your family and friends. This is how we keep the word out and we can help people to help themselves.